Welcome to the Dr. Izzy's Medical Podcast channel.
Lymphoma. Lymphoma is a group of blood malignancies that develop from lymphocytes. The name often refers to just the cancerous versions rather than all such tumors. Signs and symptoms may include enlarged lymph nodes, fever, drenching sweats, unintended weight loss, itching, and constantly feeling tired. The enlarged lymph nodes are usually painless. The sweats are most common at night. Many subtypes of lymphomas are known. The two main categories of lymphomas are the non-Hodgkin lymphoma and Hodgkin lymphoma. The World Health Organization includes two other categories as types of lymphoma: multiple myeloma and immunoproliferative diseases. Lymphomas and leukemias are a part of the broader group of tumors of the hematopoietic and lymphoid tissues. Risk factors for Hodgkin lymphoma include infection with Epstein-Barr virus and a history of the disease in the family. Risk factors for common types of non-Hodgkin lymphomas include autoimmune diseases, HIV/AIDS, infection with human T lymphotropic virus, immunosuppressant medications, and some pesticides. Eating large amounts of red meat and tobacco smoking may also increase the risk. Diagnosis, if enlarged lymph nodes are present, is usually by lymph node biopsy. Blood, urine, and bone marrow testing may also be useful in the diagnosis. Medical imaging may then be done to determine if and where the cancer has spread. Lymphoma most often spreads to the lungs, liver, and brain. Signs and symptoms. Lymphoma may present with certain nonspecific symptoms. If the symptoms are persistent, an evaluation to determine their cause, including possible lymphoma, should be undertaken. Lymphadenopathy or swelling of lymph nodes is the primary presentation in lymphoma. It is generally painless. The symptoms, as systemic symptoms, can be associated with both Hodgkin lymphoma and non-Hodgkin lymphoma. They consist of fever, night sweats, weight loss. Other symptoms: anemia, bleeding, increased susceptibility to infections, loss of appetite or anorexia, fatigue, respiratory distress or dyspnea, itching. Asymptomatic soft swelling, which may or may not be ulcerated, is primarily seen on the tonsils, buccal mucosa, palate, gums, salivary glands, tongue, the floor of the mouth, and retromolar region. Classification. According to the World Health Organization, lymphoma classification should reflect in which lymphocyte population the neoplasm arises. Thus, neoplasms that arise from precursor lymphoid cells are distinguished from those that arise from mature lymphoid cells. Most mature lymphoid neoplasms comprise the non-Hodgkin lymphomas. Historically, mature histiocytic and dendritic cell neoplasms have been considered mature lymphoid neoplasms, since these often involve lymphoid tissue. Lymphoma can also spread to the central nervous system, often around the brain and the meninges, known as lymphomatous meningitis. Hodgkin lymphoma. Hodgkin lymphoma accounts for about 15% of lymphomas. It differs from other forms of lymphomas in its prognosis and several pathological characteristics. A division into Hodgkin and non-Hodgkin lymphomas is used in several of the older classification systems. A Hodgkin lymphoma is marked by the presence of a type of cell called the Reed-Sternberg cell. Non-Hodgkin lymphomas. Non-Hodgkin lymphomas, which are defined as being all lymphomas except Hodgkin lymphoma, are more common than Hodgkin lymphoma. A wide variety of lymphomas are in this class, and the causes, the types of cells involved, and the prognoses vary by type. The number of cases per year of non-Hodgkin lymphoma increases with age. It is further divided into several subtypes. Epstein-Barr virus-associated lymphoproliferative diseases. Epstein-Barr virus-associated lymphoproliferative diseases are a group of benign, premalignant, and malignant diseases of lymphoid cells, i.e. B cells, T cells, NK cells, and histiocytic dendritic cells in which one or more of these cell types is infected with the Epstein-Barr virus. The virus may be responsible for the development and/or progression of these diseases. In addition to Epstein-Barr virus-positive Hodgkin lymphomas, the World Health Organization includes the following lymphomas when associated with Epstein-Barr virus infection. In this group of diseases: Burkitt lymphoma, large B-cell lymphoma, not otherwise specified, diffuse large B-cell lymphoma associated with chronic inflammation, fibrin-associated diffuse large B-cell lymphoma, primary effusion lymphoma, plasmablastic lymphoma, extranodal NK and T-cell lymphoma, nasal type, peripheral T-cell lymphoma, not otherwise specified, angioimmunoblastic T-cell lymphoma, follicular T-cell lymphoma, and systemic T-cell lymphoma of childhood. Staging. After a diagnosis and before treatment, cancer is staged. This refers to determining if the cancer has spread, and if so, whether locally or to distant sites. Staging is reported as a grade between 1 and 4. The stage of a lymphoma helps predict a patient's prognosis and is used to help select the appropriate therapy. The Ann Arbor staging system is routinely used for staging of both Hodgkin lymphoma and non-Hodgkin lymphoma. In this staging system, Stage 1 represents localized disease contained within a lymph node group, 2 represents the presence of lymphoma in 2 or more lymph nodes groups, 3 represents spread of the lymphoma to lymph nodes groups on both sides of the diaphragm, and 4 indicates spread to tissue outside the lymphatic system. Different suffixes imply the involvement of different organs, for example, S for the spleen and H for the liver. Extralymphatic involvement is expressed with the letter E. In addition, the presence of B symptoms or their absence is expressed with B or A, respectively. CT scan or PET scan imaging modalities are used to stage cancer. PET scanning is advised for fluorodeoxyglucose avid lymphomas, such as Hodgkin lymphoma, as a staging tool that can even replace bone marrow biopsy. For other lymphomas, CT scanning is recommended for staging. Age and poor performance status are other established poor prognostic factors. This means that people who are elderly or too sick to take care of themselves are more likely to die from lymphoma than others. Differential diagnosis. Certain lymphomas such as extranodal NK T-cell lymphoma, nasal type and type 2 enteropathy-associated T-cell lymphoma can be mimicked by 2 benign diseases which involve the excessive proliferation of non-malignant NK cells in the gastrointestinal tract, natural killer cell enteropathy, a disease wherein NK cell infiltrative lesions occur in the intestine, colon, stomach, or esophagus, and lymphomatoid gastropathy, a disease wherein these cells' infiltrative lesions are limited to the stomach. These diseases do not progress to cancer, may regress spontaneously and do not respond to, and do not require, chemotherapy or other lymphoma treatments. Treatment. Prognoses and treatments are different for HL and between all the different forms of NHL, and also depend on the grade of tumor, referring to how quickly a cancer replicates. Paradoxically, high-grade lymphomas are more readily treated and have better prognoses. Burkitt lymphoma, for example, is a high-grade tumor known to double within days, and is highly responsive to treatment. Lymphomas may be curable if detected in early stages with modern treatment. Low-grade. Many low-grade lymphomas remain indolent for many years, sometimes, for the rest of the person's life. With an indolent lymphoma, such as follicular lymphoma, watchful waiting is often the initial course of action, because monitoring is less risky and less harmful than early treatment. If a low-grade lymphoma becomes symptomatic, radiotherapy or chemotherapy are the treatments of choice. Although these treatments do not permanently cure the lymphoma, they can alleviate the symptoms, particularly painful lymphadenopathy. People with these types of lymphoma can live near normal lifespans, even though the disease is technically incurable. Some centers advocate the use of single-agent rituximab in the treatment of follicular lymphoma rather than the wait-and-watch approach. Watchful waiting is not a desirable strategy for everyone, as it leads to significant distress and anxiety in some people. It has been called watch and worry. High-grade cases. Treatment of some other, more aggressive, forms of lymphoma can result in a cure in the majority of cases, but the prognosis for people with a poor response to therapy is worse. Treatment for these types of lymphoma typically consists of aggressive chemotherapy, including the CHOP or a CHOP regimen. A number of people are cured with first-line chemotherapy. Most relapses occur within the first 2 years, and the relapse risk drops significantly thereafter. For people who relapse, high-dose chemotherapy followed by autologous stem cell transplantation is a proven approach. The treatment of side effects is also important as they can occur due to the chemotherapy or the stem cell transplantation. It was evaluated whether mesenchymal stromal cells can be used for the treatment and prophylaxis of graft-versus-host diseases. The evidence is very uncertain about the therapeutic effect of mesenchymal stromal cells to treat graft-versus-host diseases on the all-cause mortality and complete disappear of chronic acute graft-versus-host diseases. Mesenchymal stromal cells may result in little to no difference in the all-cause mortality, relapse of malignant disease and incidence of acute and chronic graft-versus-host diseases if they are used for prophylactic reason. Moreover, it was seen that platelet transfusions for people undergoing a chemotherapy or a stem cell transplantation for the prevention of bleeding events had different effects on the number of participants with a bleeding event, the number of days on which a bleeding occurred, the mortality secondary to bleeding, and the number of platelet transfusions depending on the way they were used. 4 chimeric antigen receptor CAR T-cell therapies are FDA approved for non-Hodgkin lymphoma, including lisocabtagene maraleucel, axicabtagene ciloleucel, tisangenlecleucel, for large B-cell lymphoma, and brexicabtagene autoleucel, for mantle cell lymphoma. These therapies come with certification and other restrictions. Hodgkin lymphoma. Hodgkin lymphoma typically is treated with radiotherapy alone, as long as it is localized. Advanced Hodgkin disease requires systemic chemotherapy, sometimes combined with radiotherapy. Chemotherapy used includes the ABVD regimen, which is commonly used in the United States. Other regimens used in the management of Hodgkin lymphoma include BCOP and Stanford v. Considerable controversy exists regarding the use of ABVD or BCOP. Briefly, both regimens are effective, but BCOP is associated with more toxicity. Encouragingly, a significant number of people who relapse after ABVD can still be salvaged by stem cell transplant. Scientists evaluated whether positron emission tomography scans between the chemotherapy cycles can be used to make assumptions about the survival. The evidence is very uncertain about the effect of negative equals good prognosis or positive equals bad prognosis interim PET scan results on the progression-free survival. Negative interim PET scan results may result in an increase in progression-free survival compared if the adjusted result was measured. Negative interim PET scan results probably result in a large increase in the overall survival compared to those with a positive interim PET scan result. Current research evaluated whether nivolumab can be used for the treatment of a Hodgkin's lymphoma. The evidence is very uncertain about the effect of nivolumab for patients with a Hodgkin's lymphoma on the overall survival, the quality of life, the survival without a progression, the response rate and grade 3 or 4 serious adverse events. Palliative care. Palliative care, a specialized medical care focused on the symptoms, pain, and stress of a serious illness, is recommended by multiple national cancer treatment guidelines as an accompaniment to curative treatments for people suffering from lymphoma. It is used to address both the direct symptoms of lymphoma and many unwanted side effects that arise from treatments. Palliative care can be especially helpful for children who develop lymphoma, helping both children and their families deal with the physical and emotional symptoms of the disease. For these reasons, palliative care is especially important for people requiring bone marrow transplants. Supportive treatment. Adding physical exercises to the standard treatment for adult patients with hematological malignancies like lymphomas may result in little to no difference in the mortality, the quality of life and the physical functioning. These exercises may result in a slight reduction in depression. Furthermore, aerobic physical exercises probably reduce fatigue. The evidence is very uncertain about the effect on anxiety and serious adverse events.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.